Hi, I'm Larry Johnson. I'm a professor at Texas A&M University, and today we're going to talk about Introduction to Microscopy 2. We want to look at the localization of the basic tissues, where are they located, the magnification, and the staining types of stain that are there.
So if we look at the four basic types of tissue in this skull, we would see epitheliums in the eye, of course. Epithelium lines your nose, epitheliums in your skin, and epithelium lines cavities. That's what epithelium does. It lines things, and it does it because it has junctions between adjacent cells, and those junctions allow cells to hold hands, and they form a cavity. Connective tissue, of course, we have connective tissue in the skull. We have connective tissue in the nose supporting things. We have bone or the fat or connective tissue in your chin, and of course we already mentioned the fat is connective tissue. Muscle, of course, muscle in your neck and in your jaw, muscle in the eye, nervous tissue, of course, the brain, and the eye also have nervous tissue in it. There's nervous tissue in your skin. That's how you can feel things, and there's spinal cord nerves. So if we take a look at the eye, we can see some of the images that we are seeing. And so this is the eye. You can see the lens and lining this cavity here. Lining the surface would be epithelium, and also lining this cavity here is epithelium. Actually, it's the endothelium. It's a certain type of epithelium known as endothelium. We also have epithelium on this side. You see the epithelial cells through there. In fact, the whole lens is composed of epithelial cells that we were seeing. And we can look at the esophagus. Take a look at that right quick. Here's the esophagus, and we see stratified squamous epithelium lining the esophagus in through there, and on the outside here we see it lining the trachea as well. So epithelium aligns things, and if we look at a little finger, from a little fetal finger, we can see the epithelium lines the outside of the finger. Epithelium also lines blood vessels that are there. These are endothelial cells, a type of epithelium. Here, this little arteriole here, a little venous here. You can see the white blood cells and the red blood cells in this connective tissue. And so, also there's there's a lymphoidal tissue throughout the body, and there's certain places that you have lymphoidal organs, like the lymph node is one place. But lymphoidal tissue is throughout the body. You'll be able to see that. Also, there's different types of blood vessels to accommodate the different functions. Regardless of the type of blood vessel, the arteriole, the capillary, or the venule, you have endothelial cells lining the lumen. And the size of the lumen varies, as you can see, and what's in the wall varies. A lot of muscle in the arterial side, no muscle in the capillaries, and then you can pick up some muscle in the larger veins. And also, wherever you have blood vessels, normally you have draining lymphatics to return the fluid that might leaked out with edema, return that back to the bloodstream. So if we take a look at some of those, this is a spermatic cord that we can see, and this is just some vessels that we see in the spermatic cord. Here's some nerves in the cord, but this is an artery that's in the cord, and more nerves that we see. Another arteriole here, another arteriole there, and you should be able to see some. This is fat cells here, arterial nerve, arterial vein that we see there. Usually wherever you see a artery, there's a vein pretty close by it. And also we can see lymphatics, and the endothelial cells also line the lymphatics as well. So if we look at the bile duct, this is the bile duct here. This is a vein. This is a portal vein, hepatic portal vein. And we can see that there's circular muscle in this large vein, but there's also longitudinal muscle. But you still have endothelial cells lining it through there. So we have muscle, we have connective tissue. These are fibroblasts of connective tissue. So a blood vessel would have an intima, which is certainly at least endothelial cells, media, and the adventitious. So muscle, and then here is the bile duct. You can see that has different type of epithelium on the surface. It has a simple columnar epithelium. These are plasma cells that produce antibodies. These are fibroblasts that we see here. And then if we looked at the human uterus, we can look at that right quick. We can see glands that are there, and again that's epithelium, and we see lots of lymphatic cells in through there, which is quite often we can see that, but a lot of fibroblasts in through there, and we also see muscle. So this is smooth muscle. We can see the fibers of the pink is the actin and myosin, and then the blue are the nuclei. And these are longitudinal views, and these are cross-sectional views, and so the nucleus is pretty much in the middle of the cell. So in terms of microscopy, there's different types. We look at it with a microscope, but the specimen here have a condenser which condenses the light in through there. We focus it and we move the stage is pretty much what it is. Now there's a difference in magnification and resolution. Resolution, what we're really concerned is the smallest distance between 2 points that can be distinguished. That's what resolution is, and it varies. It's nanometers for electron microscopy. In other words, you can see very small things. It's micrometers for light microscopy, and it's millimeters for us. So it's about 1,000-fold between our eye and a light microscope, and another 1,000-fold to electron microscopy. Tissue needs to be fixed or preserved, and it will deteriorate if it's not. So you have a fixative that preserves it. It needs to be rigid in order to section it, to cut it thin, you can cut a hard-boiled egg very thin, but if it's not hard-boiled, it won't cut at all. And that's what you have to do to tissue, and you do that with paraffin or plastic. And so those are the different stages that you have. And then you stain things, and staining allows certain things to be evident and other things to be less evident or a different color. And so you can use different types of stains. Periodic acid shift is one of the stains that you see that stains carbohydrates. And here in this piece of kidney, we see the proximal tubule brush border is PAS positive. In other words, it has lots of sugars on it. The basement membrane in the glomerulus has a lot of sugars associated with it. You can't see the sugars in this toluidine blue, but you can see the goblet cells, intestinal absorptive cells, and muscle cells. This H&E preparation, again, you can see the nucleus and the cytoplasm of the cells, and you can see the different shapes of cells. So those are PAS, H&E, toluidine blue. For toluidine blue, everything is one color, so you have to look at shape, size, and intensity of things. So if you look at light microscopy versus electron microscopy, because the resolution is much better, you can see more detail. So like this is an endothelial cell, which is like that cell there. And this is a podocyte, which is like this cell. So we can see details of these cells and how they interact with these, And here we can see a blood vessel. There's the same lumen there as here, except you can see that it's actually a fenestrae in there. You can see details. Here's a piece of stomach with toluidine in blue. You can see mitochondria and things, but here with the PAS stain, you can see surface mucus cells, mucus neck cells, so you can identify cells which are rich in carbohydrates. This is toluidine in blue. You can see what we saw with the PAS stain is droplets that we see there, which is the surface mucus cells.
We want to thank the various original sources of many of the images and diagrams that we have used in these presentations that were obtained from other sources, and hereby thanking them on this presentation. That's the end of Introduction to Microscopy 2, locations of basic types of tissues, of magnification, and stain types. Thank you.